My name is Cassandra. I am part of the office staff here at Catalytic Health Partners, and I am in charge of transportation and medical records.
What drew you to this position?
Well, I think that it's very important for everyone to get the adequate health care that they need, whether it's something as small as getting to the appointment or even scheduling it for them. And I think that I'm very happy with my role that I do here because it's things as little as that helps people get the care that they need.
When you talk to the members, you spend a lot of time talking to people every day. What do you feel that connection? How do you make a connection with people over the phone?
Well, like you said, over the phone it might be a little difficult because you don't get to see these people kind of face to face. But a lot of it is kind of getting to know the person like through the phone as much as you can, what their needs normally are or what it is that they're normally asking for, and having that, oh yeah, it's you, so you calling to schedule transportation? Yes, I am. Okay, so where are you going? So things like that, getting to know someone as much as you can, even if it's through the phone.
What is your role and your primary responsibility at Catalytic Health Partners?
My main role here is I'm in charge of transportation. So I make sure that I schedule the transportation for the members. I make sure that they get picked up on time and get picked up even after the appointment as soon as they as soon as possible. And I'm also in charge of requesting medical records and keeping an eye on the HIE just in case there's any members that were admitted into the ER in previous day or so.
Tell me about 3 things that you love about your work.
I love that I'm kind of, in charge of making sure that these people will get to the appointment and will get to, this appointment for this referral or for, to do these labs that they truly, need very much. And I also love that, after the appointment, we request the records so that we can further help that member get the care that they need, but for our end this time.
Can you tell me an experience that you had with a member that you think really made a difference, changed maybe or helped them improve or save them?
Well, when I first started here, I was onboarding and I was, reaching out to people, letting them know about our program and what it is that we do for them. And I had a lot of people that agreed to it and they were looking forward to it, but there was also some people that, weren't so great about the idea, or they were just not very, interested. And I remember one particular member where he was very upset with me when I first reached out to him. He hung up on me. He ended up calling, the office a few days later, apologized. We got him enrolled into the program, and now he calls all the time. He got to know everybody here in the office. We've helped him through a lot, and I think that we really made a difference in his life, and it makes me happy that I at least try to reach out to people and let them know. And even if they're a little bit resistant about it at first, so, they may or may not come back and try to get the program, try to get to know the program a little bit more. So it's happened with a few members where at first there's a little bit of resistance, but eventually they kind of, once they get to know us a little bit better, they get comfortable and they see how it is that we can help them.
That's great. What do you think is the most rewarding aspect of your work?
I think the most rewarding part is, having the members call sometimes. Like just recently, they call in, they say, they thank us, they thank me for, helping them get their medications or get to their appointment, or sitting on hold for maybe 30 minutes until, I finally say, this person needs to get here now. They can't miss this appointment, and I like kind of being that advocate for them. And I like calling on behalf of people, for maybe people that maybe can't call themselves and things like that. So I think that's very rewarding.
That's huge. Can you tell me about what you've learned through yourself about working with people in healthcare?
I think I've become a little bit more open. When I started, I wasn't as extroverted, I guess, as I am now. But once I was, able to get in, hold of people and reaching out to them, letting them know about the program and calling for them for transportation and, like I said, advocating for them and making sure that they get where they need to be whenever it is that they have to be there. I kind of learned how to stand up for not only them, but for myself a little bit more. So I think that was also very rewarding.
It is really rewarding. Mm-hmm. When you were calling people to explain, can you tell me how you explain to people in the onboarding process about CHP and why it was important?
Mm-hmm. So I reach out to them and I let them know that we sent them a letter about some new additional benefits that they qualify for on behalf of their health plan care first, completely free. I explained to them a little bit about it. We let them know that we have medical education available for them. We also help with transportation, assistance with maybe food or clothing if that's what they need. And I also let them know that, I'm just listing a few examples because not every member is the same and they're not going to have the same needs. So I try to kind of convince them to get an appointment with a care coordinator so that they can explain and see what it is that they need personally, as opposed to just listing off a few examples that we have based off of other members' needs.
That personalized approach, what do you think makes, is that something unique that you think Catalytic does, not unlike other providers?
Yeah, so some members might need help with food, but they can get to their appointments and vice versa. I know I had some members that when I was onboarding them, they were like, oh no, I don't need any of that. I do need help with dental, and we're like, oh, we can help you out with that. It doesn't have to be, if you don't need food, obviously we're not going to go and get you food, but if you need dental, we'll be happy to help you with that. So that kind of, I think that really kind of stands out to them. So because they know that it's not like regular healthcare where patients are just seen as a number, but we see them as an individual and as a person.
What do you think health plans should know about the work that you do?
I'm sorry, the question.
What do you think the health plan should know about the stuff that you do that maybe they don't see every day, that you're doing on behalf of their members?
Well, like I said before, I think it's important for them to not at all see these patients as like numbers or, how close am I to my 5 o'clock, but they're people with needs, and it's important to recognize that. Some may need more things than others. I just think it's important for the healthcare to recognize that, these are individual people and they're not just, a burden.
Can you tell me about maybe something you've seen as a result of addressing social issue first? Have you seen that by the experiences that you've had? The things you learned about by maybe addressing those needs ahead of some of the more physical health needs?
So when I started, I had no idea that the number one reason people aren't getting the adequate help that they need is because they can't even get to their appointments, and it's something that I can kind of see as myself taking for granted, that I have a way to get to my appointment if I have an appointment, but not everybody has that, and something so small like that can prevent someone from getting the adequate health care that they need. And so that's why I'm also glad that I'm kind of in charge of that, so that I can help some people out with that.
Can you maybe tell us a little bit about how you use technology and how that into what you do?
So whenever I schedule appointments for transportation, I know that when I schedule them under a member's profile, they can also see it on their tablet. And I schedule too so that they know when they're supposed to be getting picked up and the time of their appointment, so that they can see that in front of them. And I also, whenever there's records available on the HIE, I download those and I put them under the member's profile, so they have that if they need that, or even if the nurse practitioner needs that, that's there available for them. And I think it's very helpful that with the tablets that we have available to the members, they have access to all of that, and you wouldn't normally have that in a regular health clinic.
That's really important. What do you think what one thing should people know about you that maybe others might not know?
Can you repeat the question?
Yeah, let me phrase it another way. You work with a team of people. What one thing maybe the team members don't know about you or what you do, and that you'd like others to know about?
Kind of have an answer. I'm just trying to figure out a way to get it started. Like I said before, I wasn't the most kind of extroverted person. So initially it was kind of difficult for me to kind of, even reach out to people and talk to them and, get them familiar with the program, or even if I'm calling on behalf of them with, transportation, it was kind of difficult at first because I'm just not used to that. But moving forward, I think that eventually I learned that it's important to, stand up for yourself as well as for others. And
that was
a hard question. I'm sorry.
Yeah, no, you answered it very well. What do you think is so important about in-home care?
Well, some people, even if, with medical transportation available, they're homebound, so not very much of that is available. Most of the time it's all, get to the appointment, I don't care how you do it, just, get there. So I think it's important, and I really like that we offer to visit the members in their home, and we kind of get to know them a little bit based off of, how they're living and see how they're, what it is that we can further help them with.